Evidence of the disease can be seen on an affected skeletal remain from 8000 BC and on a skeleton in Egypt dating from 2000 to 1500 BC. The infection is microbiologically proven and was discovered in a mummy of a young Peruvian native 700 BC. Ancient Indians and Chinese writers refer to the disease describing its clinical signs, and Hippocrates found small ulcerative lesions on the lungs of the sufferers and named those tubercles. Tuberculosis now exists throughout the world, but it is more common in sub-Saharan Africa, Asia and Eastern Europe. This disease is caused by various strains of mycobacteria, usually from Mycobacterium tuberculosis. In some countries, it is estimated that up to 10% of tuberculosis in humans is due to bovine tuberculosis. Over the years and through the development of technology, we have learned the mechanism of survival and transmission of tuberculosis bacteria. Tuberculosis is an infectious disease that primarily affects the lungs and other parts of the body. When an individual breathes in droplets containing TB bacteria, they can get TB. The droplets originate from an already infected person, and when they sneeze or cough, the droplets are released into the air. TB is only spread through the air. You cannot get TB through food or water, kissing, skin contact, and so on. People who have been recently infected with TB bacteria or with a weakened immune system have a high risk of developing TB disease. In the case of bovine tuberculosis, a man can be infected by drinking raw milk from infected cattle or by inhaling infected aerosols. TB bacteria infection can lead to two conditions: latent TB infection and TB disease. A person with latent TB infection has no symptoms, does not feel sick, and their condition is not contagious. A person with TB disease is symptomatic, feels sick, and their condition is contagious. Most people with latent TB infection will never develop TB disease. In these people, TB bacteria remain inactive. However, TB bacteria can multiply and cause TB disease to those who have a weakened immune system. There are several factors that can lead to a weakened immune system: young age, HIV infection, diabetes mellitus, substance abuse, etc. The main symptoms of tuberculosis are fever, reduced appetite, weight loss, night sweating, a persistent cough that lasts 3 weeks or longer, cough with blood at an advanced stage. There are two tests one can do when suspected with TB: TB skin test, Mantoux tuberculin skin test, TST, and TB blood test. These tests determine whether an individual is infected with TB bacteria or not. To determine whether the person has TB disease, chest X-ray and sputum, mucus coughed up material from the lower airways test can be done. With the right treatment, it can be cured, but in neglected cases, it will leave scars or deformities in the organs. Those with TB disease need to be treated with several drugs, such as isoniazid, rifampin, ethambutol, and pyrazinamide for 6 to 9 months. It is important for patients to take drugs correctly. If they do not take them as prescribed, TB bacteria may become resistant to those drugs. The measures that should be implemented to prevent and eradicate tuberculosis are as follows: BCG, Bacillus calmette-guerin vaccine. However, its usefulness is controversial. Finding all infectious or potentially infectious individuals. Effective treatment in all patients infected with TB bacteria, especially the TB disease patients. For bovine tuberculosis, controlling cow's milk infections by pasteurizing and controlling the disease in the fields. Through World Tuberculosis Day, there is an opportunity to discuss the disease further and prevent it. Let's be educated so we can be protected. Let's take care of ourselves, our children, and all of our society. Let's act for one health.